Bong. Look, she's doing this for the sake of science, and
Yes.
I'm doing it because I love this inaanak of mine. So what can
So
I
he
do?
is my patient for today.
This is terrible. Okay.
Before doing the neck physical examination, number 1, seat the patient comfortably. Number 2, obtain his or her consent. Number 3, explain each procedure and its purpose briefly. Number 4, remind the patient that he or she can ask questions and can stop the procedure anytime. The first step of the physical examination is inspection of the patient's neck. Check for any asymmetry and head tilts, any masses, skin discoloration, scars, or edema. For our patient, there is a visible scar on his right neck, just lateral to his laryngeal prominence. Check if there is any visible tracheal deviation. The second step is to palpate for the patient's lymph nodes. You can choose to stay in front or at the back of the patient, but I prefer to palpate from the back. Remember to palpate using the pads of all your fingertips because they are the most sensitive parts of your hands. Examine both sides of the head simultaneously, walking your fingers down the area in question while applying steady, gentle pressure. Let's start with the patient's submental lymph nodes and work our way towards his submandibular nodes. As we palpate, we try to feel for his submandibular glands. And then we check for his preauricular lymph nodes. Followed by his posterior auricular lymph nodes. We now palpate for his anterior cervical lymph nodes. Remember that deep palpation at the level of the carotid bifurcation may result in bradycardia and syncope, so be careful. Don't forget to palpate the patient's occipital lymph nodes, followed by his posterior cervical lymph nodes. Now, we palpate the patient's sternocleidomastoid muscle, also known as the SCM, and check if there are any masses, atrophy, or nodules. To better appreciate the patient's SCM, you can ask him to push his forehead against your palm. Begin palpating the SCM. Don't forget to check the other side. Lastly, we palpate for the patient's supraclavicular lymph nodes. Followed by his infraclavicular lymph nodes. The third step is to palpate the patient's anterior neck, including the thyroid gland. Palpate the patient's cricoid cartilage, and just below it is the thyroid gland. Ask the patient to swallow. This will make the thyroid gland slide under your fingers. Normally, the thyroid gland is not palpable. You can also move inferiorly and palpate his tracheal rings. This ends our physical examination of the neck. Don't forget to thank your patient and give him a summary of your findings. Before doing the ear physical examination, number 1, seat the patient comfortably. Number 2, obtain his or her consent. Number 3, explain each procedure and its purpose briefly. Number 4, remind the patient that he or she can ask questions and can stop the procedure anytime. We start the ear examination by inspecting the patient's ear. We check the color of the pinna and any other abnormalities, masses, lesions, discharge, or scars around the auricle. We also check for tenderness by manipulating the tragus and the auricle. We will now perform otoscopy. You can hold the otoscope like a pen or hammer, but I prefer to hold it like a pen. Pull the auricle upward, backward, and outward because our patient is an adult. Make sure that your otoscope is turned on before you insert it gently while mounting your little finger against the patient's cheek. You can now better appreciate the external auditory meatus and the tympanic membrane. Move the speculum around to examine the whole tympanic membrane and identify the normal landmarks, including the handle of the malleus, the light reflex in the anterior inferior quadrant, and the pars flaccida superiorly. Gently remove the otoscope and repeat the examination on the patient's other ear. Do not forget to thank your patient and give him a summary of your findings. Before doing the nose physical examination, number 1, seat the patient comfortably. Number 2, obtain his or her consent. Number 3, explain each procedure and its purpose briefly. And number 4, remind the patient that he or she can ask questions and can stop the procedure anytime. Before inspecting the patient's nose, remember to wear the head mirror on the same side as the light source and hold the nasal speculum on the side opposite the light source. Hold the nasal speculum correctly, extend your index finger, and position it on the patient's cheek or nasal tip. This will steady your hand as you examine the patient. Insert the speculum just until past the nasal vibrissae and open gently. Do not stretch the ala too much. Withdraw gently with the speculum still partially open to avoid hair avulsion. You can now perform anterior rhinoscopy on the other side. Do not forget to thank your patient and give him a summary of your findings. Before doing the oral cavity examination, number 1, seat the patient comfortably. Number 2, obtain his or her consent. Number 3, explain each procedure and its purpose briefly. Number 4, remind the patient that he or she can ask questions and can stop the procedure anytime. Remember to wear the head mirror on the same side as the light source, and focus the light inside the oral cavity. Use the wooden tongue depressor to retract, push, or depress structures to facilitate inspection. Inspect all surfaces including the patient's teeth and gingiva, buccal mucosa, tongue, floor of the mouth, hard and soft palate, tonsils and pharyngeal wall, and the oropharynx. Do not forget to thank your patient and give him a summary of your findings.